My name is Mark Seeley, and I'm an athletic trainer with Crossing Rivers Health. I've been an athletic trainer for about 28 years. I've been here at Crossing Rivers Health for 20 of those years. I'm here to talk to you today a little bit about concussions. So 20 years back, we used to actually call those bell ringers, and we don't really refer to that anymore. And so now what we want to really relate that information to is that it's a traumatic brain injury. It's actually an injury to the brain, and we don't want to dismiss those injuries or make them seem like they're small. They're very significant injuries, and we want to make sure that we take care of them correctly. Typically, concussions or traumatic brain injuries happen when we get a sudden jarring to the head or to the brain. And this could occur from direct contact, like helmet-to-helmet contact in football, maybe a student athlete getting hit in the head with a volleyball, or potentially it could even just be a sudden jarring motion where we get a twisting mechanism of the head. So somebody gets hit from the side and the head wobbles back and forth, and we can cause an injury to the brain as well. There are significant reasons why this happens more with adolescents than we see in adults. Is that the adolescent brain is still developing, and it's not the same as an adult brain. So we have to take that a little bit more seriously. Typically we see that adolescents tend to be a little bit weaker. Their neck, especially in our female athletes, our neck structure is a little bit weaker, and it doesn't stabilize the head and the neck or the brain as well as adult athletes. So there is a little bit of difference between the adult and the adolescent athlete. Typically, when we have a head injury, it happens in essentially 4 areas of function that are affected. First is physical. We'll see physical effects on the body. They may see dazed, confused, tired, have trouble with doing simple functions, balance, coordination, things like that. Another area of function is the cognitive function. So a lot of times we'll see people will have problems with their thinking and processing, or being able to pay attention or recalling information. They may forget ideas and information as well. Number 3 is an emotional area. Sometimes athletes will feel, after a concussion, they may feel depressed. They may have problems dealing with their emotions, and those can affect how they interact in a daily activity, either at school or with their athletes, with their friends, and certainly at home as well. And then sometimes we'll also see sleep disturbances. They may need more sleep, they may sleep a little bit less, they may have interrupted patterns of sleep. So those are the 4 areas that function that typically we see that go along with head injuries. Let's talk a little bit about if an athlete actually had an injury. So say we've got a football player, basketball player, somebody gets hit during practice, and what typically is going to take place during that. We don't expect coaches, athletes, parents, or staff to be able to diagnose a concussion, but we do expect that they're able to recognize those signs and symptoms. So if an athlete presents with an injury, we are expecting our coaches to be able to immediately remove that athlete from play. And they're not able to return back to activity or return back to play until they've been cleared by a healthcare provider. And the reason why we do this is because a lot of times athletes are very poor at self-reporting those injuries. They don't want to tell you that they're hurt. They don't want to sit out for a game. They don't want to miss that playing time. So we have to have essentially people that are going to be able to recognize those signs and symptoms and then do the right thing for that athlete. Sometimes athletes either they can't or they won't admit that they're hurt. And that may be because of the injury, or just because, like most people, they don't want to miss those opportunities. They don't want to let their teammates down. They don't want to let their friends down, or they don't want to disappoint the coach and that they're hurt and they can't play in the big game. So we expect, though, that those parents and those coaches, our staff, athletic trainers, everyone involved with sports is able to recognize those signs and symptoms of a concussion and be able to remove that athlete from play immediately. So what are the signs of a concussion? Well, first of all, signs are what we observe when somebody is injured. So it could be that they're dazed, maybe they're confused. We may have some different levels of consciousness. They may actually become unconscious. Someone being unconscious doesn't necessarily mean that they have a concussion, or vice versa. Concussion isn't always accompanied by somebody going unconscious as well. They may have balance issues, maybe coordination issues, feeling slowed down, and being forgetful. So those are some of the signs of a concussion. Symptoms are a little bit different. Symptoms are what the athlete feels. And these are going to be things like the athlete is going to have a headache. Maybe they're nauseated, a little bit dizzy. Sometimes bright lights or noise will affect them as well. Sometimes they're agitated or maybe even a little more emotional. Some explained crying or things like that. We've seen it on the sidelines of games before where they just don't handle that traumatic experience well. And we'll see that happen as well. We've had a state law in place since 2012, and that state law indicates that whenever we have somebody that presents with signs and symptoms of a concussion, or they are suspected of being injured, that we have immediate removal from play. And that's the number one thing there, is that we don't want to allow somebody that you suspect may have a concussion. Again, you don't have to diagnose it, we just have to be suspicious of that we're going to remove them from play and make sure they're safe. And the reason why we do that is because of something that's called a second impact syndrome. The second impact syndrome occurs when an athlete who's already sustained a head injury continues to play, and then they get hit another time or two again, and what happens is they can have a catastrophic brain bleed, which then can relate to severe, very severe long-term consequences and potentially even death. And those are the stories that you hear on the ESPN, 30 for 30 or 60-minute sort of stories, where we see athletes who, go down a path of potentially harming themselves, or also just end up not being able to function in society. So we want to make sure that we remove those athletes from play immediately. So what happens on the sideline? Say athlete then has a severe concussion. Somebody is a little dazed, confused. Maybe they start going unconscious. Maybe they start vomiting. Maybe they start being really uncoordinated, or we see deteriorating signs and symptoms of that concussion symptoms. Well, that's the time that we need to call the emergency medical response. That's where we need to have the ambulance come in, and we need to do immediate transport to the hospital. Usually, though we don't see those very often, but we need to make sure that we're treating those athletes in the right way during those times. Though now we've got an athlete who's potentially on the sideline of a football game, and say I'm present, or maybe it's a day or two after the injury, and I have that athlete in the office and I'm taking a look at them. I'm going to do an evaluation, and typically what we use is what's called a SCAT form. Now, SCAT basically is just it's SCAT, and what it is a standardized assessment of concussion. And what that test is that I go through and assess their cognitive ability. So I give them a whole bunch of questions about where they are, their time, date, place, all those kind of things. We evaluate whether or not they can remember words and number sequences, basically give them a little mini mental test and make sure that things are functioning normally. And then we can score that and basically quantify how they're doing on that test. Then we can use that test then to continue to evaluate them over the next couple of days to make sure that they're making the right progress. Other things we'll check at that time are going to be their balance. We're going to do special tests for the head to see whether or not they may have an injury to the vestibular system. The vestibular system is the balance and the coordination system that's located in the ears. An injury to that can go right along with a concussion as well. So we screen for those types of things. And then we also do what's called a symptom checklist, where we have the athlete rate their symptoms and how they're feeling, and then we can keep track of those symptoms over the course of the duration of the injury. And what we should see is that those symptoms gradually decrease over the next 2 to 4 weeks or so. So our initial treatment, after we've evaluated that athlete, determined yes, they do have a concussion, then our initial treatment is going to be for that first 24 to 48 hours is really just rest. We want to do physical and cognitive rest. So we're going to remove them from play. We're not going to have them out running around. We're not going to continue to participate in sports. We're going to let them have lots of sleep. We're going to have them rest, be in an area where they can get good rest and good sleep. We're going to draw the shades so that the bright lights and things like that don't bother them. And then we're going to also limit their screen time. So mom, dad, sorry. Kid, sorry, we're going to take away your phone, and we're going to take away your laptop and your computers and those screens. We're going to limit that screen time. Now, we don't want to completely put them into hibernation, but we want to kind of let that brain reset, give them time to recover. And that's for the first 24 to 48 hours or so. But we also don't want to do what's called cocooning, meaning that we don't want to keep them there for a long time, for those 2 to 4 weeks. We want to get them eventually easing them back into school, back into their daily activities, and back into their routines. And we'll do that slowly with different accommodations and modifications in their school day, and doing things to help them get back into activity. So things like we may limit, again, their screen time. We're going to probably limit a little bit of their physical activity. Sometimes make some accommodations to their homework. They may have to have a little less homework, potentially have somebody take notes for them, limit the number of tests that they're taking through that time, and make some different modifications with their academic schedule if we need to. Allowing them to wear, if bright light's bothering them, maybe allowing them to wear sunglasses to school. Maybe they're eating lunch in an office away from the loud noise of a lunchroom and things like that. So we'll make some of those different accommodations for that athlete throughout the time that they're still having those signs and symptoms. And then those gradually fall away as they start feeling better and get them back into a full academic load and back into normal classrooms and testings, things like that. Then what we do is we follow a return to play protocol. And so once they are signs and symptom free for 48 hours, so 2 full days of, they come to me and they say, yep, I feel great, I feel perfectly back to normal, I'm not having any accommodations or need for those, I really feel back to normal, I'm feeling good, then we'll do what's called the impact test, computerized neurocognitive test. It's another evaluation tool that we can use. And what we can do is compare the post-injury test to their baseline test and make sure that those mash up and that they're looking good. And when they pass that impact test, then we will follow a gradual return back to play protocol, which is a stepwise protocol where we gradually increase our activity from a few minutes of working out, doing cardiovascular work, and then another 24 hours, and we'll add in a little more work. And each day we'll take a little bit more at practice, gradually working into functional activities, gradually working back into full practice, and then eventually back into full contact practice at the end of that time. And that usually takes about a week to really complete before we get there. So once we do that, then we can return that athlete back to play. If at any time during that return to play protocol they develop signs and symptoms again, we start the clock over and we just proceed with that return to play protocol from there. What are some of the things that we can do to prevent concussions? Your coaches are doing a great job of, with you football players, learning different tackling techniques, taking the head out of football. So we're not leading with the head, we're not directing contact with the head, we're hitting with the shoulders, getting the head off to the side when we tackle. And things like that. We're limiting, the WIA has limited the amount of contact time in football practice. With other sports, what we can do are really focus on strengthening the neck, the head and the neck to support that. So if we're stronger with the muscles in the neck, then we don't get the head wobbling quite as much, and that'll limit some of that head injury as well. So those are the things that we can do to help prevent concussions. But really the number one thing is, again, recognizing those signs and symptoms and immediately removing that athlete from play, and then getting them to a proper healthcare provider to take care of them and make sure that we're going down the right path. The number one thing with concussion care is, when in doubt, sit them out. Thank you.